Hi, I'm Dr. Ed Loftus. I'm a professor of medicine in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota. And I wanted to talk to you today about a paper we recently did entitled Overall and Cause-Specific Mortality of Inflammatory Bowel Disease in Olmsted County from 1970 through 2016. And this paper will be published in an upcoming issue of Mayo Clinic Proceedings. So this was a population-based inception cohort study. So these were patients who were Olmsted County residents and diagnosed with either Crohn's disease or ulcerative colitis between 1970 and 2010, and then followed through their medical records through 2016. Olmsted County is unique because there are only two major healthcare systems that administer healthcare to the residents of the county, and it's due to something called the Rochester Epidemiology Project. It's one of the few places in North America where you can do true population-based studies and also have access to the patient's full medical record so that you could actually validate any diagnostic codes that are identified. And so we've done studies previously using this cohort, but what we wanted to do this time was update causes of death in inflammatory bowel disease. These are chronic inflammatory conditions, and there has been some controversy as to whether or not they affect long-term survival. There's been a sense that maybe mortality in Crohn's disease is a little bit higher than in ulcerative colitis, but the studies have been conflicting. We had previously published on this in Gut about 12 years ago, but we thought we should update our experience. So we had 900 patients with either Crohn's disease or ulcerative colitis, roughly 400 with Crohn's, 500 with ulcerative colitis. We also identified 5 age and sex matched controls who didn't have IBD for each case. We also had U.S. mortality data that we could use as an expected. And so we calculated relative mortality two ways. One was using the U.S. expected data, which was again adjusted to age and sex. And we also had the control group. And so we did a Cox proportional hazards regression analysis looking at causes of death in that population. And we were also able to stratify that latter analysis by general groups of causes of death, say cardiovascular disease or respiratory disease, GI disease, etc. And so what we found was that in Crohn's disease there was a little bit of a trend towards increased mortality, but not quite meeting statistical significance either way we did the analysis. So the relative rate of mortality was about 1.2, and that held true either way you did the analysis, whether you were using the U.S. specific data or the Olmsted County non-IBD controls. And within the Crohn's cohort, the overall survival was, like I said, 1.2 times higher. For digestive diseases, it was elevated, and for pulmonary diseases, it was elevated, but for the other subsets, there was no elevation. There was a trend, non-significant, for cardiovascular disease as well. Interestingly, in the ulcerative colitis cohort, there was actually a statistically significant lower mortality rate in the UC patients compared to the US population, but when we looked at it in the Mayo or in the Rochester specific non-IBD controls, there was a trend towards a decreased mortality rate, but it didn't quite meet statistical significance. And then within ulcerative colitis, there was no one specific cause of death that was statistically significantly different from the controls. Maybe a little bit of a trend towards an equal cardiovascular mortality, but and that was different than the Crohn's patients where there was a trend towards an increase, but that was about it. And so what we could conclude was maybe a trend towards an increased mortality in Crohn's disease, clearly a lower risk of mortality in ulcerative colitis. And people ask, well, why may this be? One easy explanation may be cigarette smoking. We know that ulcerative colitis is a disease of non-smokers and ex-smokers, and so maybe the smoking in Crohn's disease might explain a trend towards increased cardiovascular mortality. But this is really just speculation, and I think we just add to the body of literature that there might be a slight impact on mortality in Crohn's disease, but not in ulcerative colitis. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.